we thought for this event we'd have an engaging and provoking discussion, a bit of a think tank discussion around what's the future look like with regards to workplace mental health and wellbeing and all these things that we've been working with for 20 years. And so we thought what a great way to have a panel. To head and lead and MC, chair, coordinate the panel is Katherine Newton, the CEO of Are You OK? If many of you have seen Katherine before, know of Katherine. She's spoken at our functions before. And Are You OK? I don't think in this room is new to anybody in terms of the campaign for suicide awareness and prevention. In its 11th year, we've been associated with Are You OK now for 10 years, just after it started. And it's just been a wonderful partnership with us in terms of not only the work we do at the front end, the pointy end, I guess, in terms of prevention and intervention, but also then supporting organisations like Katherine's and others with regards to the work in the broader space. Katherine has spent over 8 years, first of all, trained as a volunteer lifeline counsellor prior to transitioning professionally into this sector. She leads a very small but very dynamic and robust team. What your team does with the resources you have and the people is just amazing. The level of brand awareness of Are You OK has just gone up and up and up and up and up over the last a few years. And I think there's not too many people in this country that have not heard or know what Are You OK stands for. So I'm going to introduce Katherine, and then she's going to introduce our panel. Thank you once again, Katherine.
Thank you. Good afternoon, everyone. I guess I don't need to talk to that, do I? I've got my wonderful mic. Thank you for that introduction, Tony, as always. And you're right, Are You OK is now 10 years on, and it is thanks to a wonderful team that we have. There are, for those of you that don't know, there are 10 of us at Are You OK? Ruth Markham here being one. I'm delighted you could join me today. We do a lot of fun things together. And we've just had our evaluation results in, so if anyone is interested, we do now have 87% national awareness from 80% last year. So again, an incredible jump. We always think it can't get much bigger. But more importantly, we've just had the results in that 70% of people have asked someone if they're okay in the last month. We have other measures in terms of people are becoming more willing, more able. We understand more about the behaviour of when they're having the conversation, where they're having the conversation. 25% of those conversations are happening in the workplace. And it's very much a journey and it's a movement and we keep going forwards. And what I've started to explain is that, Are You OK team, we're here and we're bringing people along on this journey. And I was just chatting earlier about the themes and how we come up with our themes every year. And of course, people now know the question. You may remember 2 years ago we had Every Day is Are You OK Day, and that was a reflection of people that have spoken to us and spoken out to say, it's not only just one day Are You OK Day, it's every day. And I'm really glad to see that that's what workplaces are embracing. And it's thanks to partnerships and friendships with Rachel and Tony and Deborah and Nicola, who are incredibly supportive. And I feel very much that this is a room of friends. I think that there's a great relationship between everybody, and there's a lot of goodwill here, and there's a lot of positivity. And I think that it's testament to all of you in this room that do take this seriously, that do take this genuinely. I think genuine is the word here. So thank you for your genuine partnership and leadership of Are You OK? It really couldn't have got where it is without you. So thank you. I have also noted down the words sophisticated and agile, which came up from the videos and also during some chats that I've had here in the room, and I think that's absolutely what a Centre for Corporate Health represents. And Rachel, you are always the most sophisticated dressed in the room, and Tony, should we say that you're the most agile? I'm not sure, but let's maybe go with those themes and see how they work into the discussion. I'd love a lady who needs no introduction. I'd like to welcome Rachel to the stage. Now, we're going to be talking about how we've come a long way in the last 20 years when it comes to workplace wellbeing. We've definitely seen the shifts in workplaces striving to achieve psychological safe cultures. But how far have we really come? Where are we now? What are workplaces focusing on now? And where will this focus shift to the future? To also help us answer these questions, along with Rachel, I'd like to welcome Justin Martin to join us here. So Justin is the General Manager of Health, Safety and Wellbeing from Commonwealth Bank of Australia. In his role, he oversees wellbeing of the group's people in over 1,300 locations in Australia. No mean feat, and its global operations. Justin is passionate about helping the bank's people and customers to support their mental health and wellbeing. Welcome, Justin. It's the first time we've met today. I'd also like to introduce Alexia Houston from Clayton Youth. Alexia began her career as a risk and insurance lawyer. She acted for local and international insurers, defending claims made against professionals, as well as representing Commonwealth departments on complex workers' compensation matters. In her current role as Head of Insurance and Risk for Clayton Youth, Alexia is responsible for managing enterprise-wide risk, as well as the firm's insurance program. The key aspect of Alexia's role is leading the firm's approach to the health, wellbeing and safety of the firm's people, including the firm's early intervention approach, and perhaps we can explore a bit more of that. Could you all join me in welcoming the panel? Rachel, I've just realised that I didn't introduce your bio. Is are we all okay that we know who Rachel is? Thank you for that. I thought we'd begin as a question to all three of you, that I think we're all interested in the room to know what shifts that you've all seen over the last 20 years of how organisations are prioritising employee wellbeing. Do you think HR has become more proactive instead of reactive? I know that we did hear some comments on the video, but perhaps would someone like to kick us off?
Yeah, certainly I can start with that one. I mean, 20 years ago, our entry point into our client organisations was very much from that reactive end, so it was always where there had been, and at that stage it was pretty much even when it's got to now a stress claim. That was definitely what we were speaking about. It wasn't even we've got someone that's not travelling so well, it was we've got someone who's now put in a claim. So we were always being drawn into very complex, and there were complex issues when it gets to a compensation claim, and litigated issues as well, grievances, all of those things. So our entry point was often at very much the pointy end, very much at I always call it the back end. And then I do think the turning point was the legislation shift that did happen in 2011, where there was then that legal motivation and impetus to get very much better at the prevention and also then that early intervention. So it did shift. We were always very passionate about being proactive, preventative, because we'd always get these stress claims go, this could have been prevented so easily a year ago. But people just didn't have that mindset. We weren't really thinking like that. We were thinking like that, but no one was, really interested in talking about prevention until that legislation really came out. And now that is very much, we see the entry point now. Organisations are willing to spend, to invest in their people before something happens. Wonderful. And that's really now probably the biggest shift that I've seen. So now we get to work at the front end, at the back end, and along the journey in between as well.
And Justin?
Oh, it's been massive. It's a quantum leap really for me. I started my career just over 20 years ago, and there was no such thing as EAP. There was really no support for employees who were struggling with mental health and health concerns. I remember when I first graduated, people that I'd worked with for a period of time just disappearing, ill health, retired, and now you look back and go, well, that was a situation of excessive stress that we didn't manage, we didn't support, we didn't help that person on their journey. I think the last 5 years, I've been in Australia for about 7.5 years, the last 5 years I've seen that pace of change and that increasing care from employees. It's coming, and it's going to keep coming harder and harder. The change is there, definitely. The will to do the right thing by people is everything.
And that's perhaps something we can draw out a bit later, that will of people wanting to do something.
Firstly, I have to say this question's making me feel a little bit old.
I know, isn't it? There's something, we're all with you there,
But I do think there's been a couple of really significant changes. To me, the conversation around mental health and wellbeing is no longer just a HR discussion. It's a business discussion. It's not a discussion I just have with my HR team. It's a discussion that I have with my CEO. And that's a fairly regular discussion. It's daily, weekly. And they're willing to have that discussion and have it part of everyday discussion at a board meeting. I mean, Rachel came and spoke at our AGM one year. That was the importance that Clayton Utes placed on this discussion. It's definitely more proactive than reactive. Moving from, as Justin said, people just disappeared, to a situation where we now try to support people so they stay at work, or so that they always come back to work. And we're really proud of the fact that people always come back to work, or that they're able to stay at work. And I think also there's a really big change is what we're willing to talk about. So a few years ago we did the Are You OK at Law campaign, and at the time, working with Are You OK on that, none of the law firms were willing to mention the word suicide. And now that's a discussion that we're willing to have in the firm when it needs to happen. It's still obviously a difficult discussion, but the quantum leap from not even willing to talk about it to having education aimed at suicide prevention, I think, is a huge change.
And I think, I think that, I'm not sure what the three of you, if you would agree, but that's where the conversation does need to go. But of course, you have to take a careful approach to having that conversation, which is why, for example, Are You OK doesn't give a guide to this is how you ask someone if they're suicidal and this is what you do, because right now for us as prevention, we are helping people to stop those small things becoming big things. Again, we're at that prevention end, but that is indeed, I think, where it will go. Alexia, you mentioned there about giving people options, that you want people to stay at work, you want people to return to work. I'm wondering, those options, is that part of what we might call a holistic approach?
Absolutely. So it forms part of our mental health framework at the firm. We've got 210 trained mental health champions or mental health first aiders that are there recognising the signs and symptoms. We've trained a lot of our leaders as well. And the old approach was someone's unwell, well, we'll see what happens and let them take some time off and maybe give them the EAP card. Not particularly helpful, whereas the approach we take now is much more tailored. What is it that the individual may be experiencing, and how can we support that specific individual, whether that's through the involvement of Resilia, whether it's through coaching, whether it might require some time off and a recover at work plan, but there's no one size fits all, and it's very holistic. And as we've moved from that the person's already gone off and we're not really sure what's happened, to we've been able to either prevent it and they've stayed in the office. For those of you who need a business rationale to do this, we've reduced our average cost of claim by 80%. So it is if you want the business rationale, that's it there. But then I think it's now about, we're also moving it to more than that, and it's about how do we change the way we're working to prevent this happening in the first place. And so it's where we've all started in the reactive, and I think we're all moving our way towards prevention.
And Justin, on that, I guess that prevention note, I mean, CBA, huge reach, and we know that we are all individuals. We all experience life's challenges, we all go through life's ups and downs, and so perhaps more on that crisis end there can be a bit more of a process and a procedure, but how do you reach the masses that you have at CBA with these early intervention and prevention efforts?
It's a great challenge. It's an amazing challenge for us. We've got 1,000 branches out there all over the country. We are seeing unprecedented levels of customer aggression against employees. What the team have done brilliantly about 4 or 5 years ago, they developed a digital platform, and that's called Thrive. Thrive houses over 1,100 pieces of custom content around any particular health and wellbeing aspect you can think of. So real thank you for Centre for Corporate Health in supporting us edit those materials. Absolutely first class. As in somebody new to the bank, I've been blown away by the power of those articles, how embedded they are in the organisation. People actually ask us for information, and the commitment from the businesses will get you an article within 10 days from an expert like Rachel or Penny. And those articles are available, and it's now becoming driven by our people asking us for support. How do we understand about my teenager going through a change, or a brilliant session that Penny ran for us from Centre for Corporate Health on preparing for death and saying goodbye to loved ones and relatives. And that courage and bravery, I'm really proud to be part of that team that put themselves in that place.
And from that, I guess, question to both you and Alexia, are you seeing that people are bringing more of themselves to work? Are they bringing more of their whole selves? Are they more comfortable with talking about what might be going home and outside of work?
Yeah, definitely. And one thing that we do is our mental health strategy is very intertwined with our diversity and inclusion strategy. And as you've seen, people, really being more comfortable to bring their whole selves to work, whether it be from a gender, LGBTI, ethnicity, and that also then, or disability, whether mental or physical, about how they then bring that to work and what they're willing to talk about. We had some amazing summer clerks start at the firm this time last year. Our summer clerks actually start next week. And they were incredible in terms of how open they were about their own mental health and experience. And we had actually 4 of them give a similar panel to this to the entire firm in Sydney, which is pretty brave for summer clerks, where they actually taught us a little bit about what it was like to be open about mental health and wellbeing, and some of the roles they'd played at university as residential advisors or on 24-hour hotlines at their universities. So certainly with the graduates and summer clerks coming through, they certainly are very comfortable to bring their whole selves to work, as they should be.
So what you're mentioning is the voices of lived experience. You've mentioned digital hubs, so places to go for content. I've got here in my notes that one organisation in the United States has appointed a chief heart officer, whose role it is to just have conversations with employees to help improve their experience, which is an interesting concept, isn't it? As more and more people are struggling with myriads of things, where does an employee's responsibility, I guess, start and stop for helping to manage that well-being?
Their own well-being. I think it's a bit of a dual role. It's certainly, if people are bringing their whole selves to work, that does automatically place a part of that in the workplace responsibility, because if somebody is coming into the workplace and disclosing, I'm not travelling so well because this is going on for me, it does mean the workplace is responsible for looking at how can we support you at work, what accommodations, what adjustments, do you need flexibility? So it is partly a workplace responsibility, but I do see it also partly a personal responsibility as well, to realise if I'm not travelling so well, or to take responsibility and ownership of my recovery. Because sometimes in the work that we do, we can be assisting people with these wonderful recovery strategies and recovery plans, but if they don't want to be part of that or own that themselves personally, the organisation cannot be responsible for somebody's recovery. So we can certainly put some good plans in place. So I think it's a bit of a dual role, partly personal responsibility and partly workplace responsibility as well.
I think a question that comes up quite often with workplaces is there a framework we should be working towards? Is there a guideline we should be working towards? Is there a handbook, I guess, almost, that tells us what we should be doing as leaders, as managers? What do you have?
Yeah, I mean, I think that's a really good question, because 8 years ago, we developed a mental health intervention framework, and many of you know about it and have implemented it. And it really came out of law firms, actually, because they were really probably the first professional group who were at risk of mental health issues. There had been a lot of media around, a lot of attention around the prevalence rates of mental health issues in law firms. So they really went first. And so they approached us and said, look, we've got some challenges here with mental health in law. Firstly, incredibly high prevalence rates that we know. Secondly, they're not easy mental health issues. They're actually complex, what we would call medium risk. Our entry point was often really complex mental health issues that we would see in the legal profession. And thirdly, we have no consistent approach in how we would manage and respond to this. What do we do? So what we were seeing in the market was, as Alexia was reflecting on before, a bit of a one-size-fits-all, which was pretty much our options are call the EAP, even for kind of really complex issues that would not be facilitated to recovery through short-term solution-focused counselling. The second option was, let's manage this legally. So let's have a look through the legal lens and look at how we're going to manage this person, which is often resulting in sometimes ending the employment relationships with that lens. And the third one was, let's get an IME, an independent medical examination from a psychiatrist. And you can imagine in a law firm environment, that's kind of not really early intervention. So they were the options that we were seeing 8 years ago. And I said, well, we can definitely put together a much better framework than that. So, and it was around giving people consistency, because people were saying, even what our office is doing in Melbourne is completely different to what our office is doing in Sydney, and we have no real concept of what we're following. So, and what we would also see is that people were kind of just looking at mental health issues as one, large group, and not really being able to disseminate between low risk, medium risk and high risk. So the frame that we built originated with the legal profession. We built it for the legal profession. We've run it out in banking and finance, accounting, media, a whole range of different industries now. But it is about having an evidence-based best practice approach, and most of the time we do get recovery using the framework. It's only in a very small percentage, but I always think no matter what outcome is achieved, the fact that you've followed a robust evidence-based process always leads to an outcome of some sort. And that's a good thing for the individual who is the person who's unwell or at the centre of it. We need momentum, and we need to get more sophisticated. So I think I have seen in the market much more sophistication now of people really implementing the framework within large corporate organisations. It is more challenging than a smaller organisation, but it's definitely possible.
I think it's, you've just got to spend some time at the beginning speaking with all of your HR leaders and managers and really talking to them about why the intervention framework is a good idea, why it works, and equipping them to have those conversations, because conversations about mental health are difficult. And so if they know how to do it, they're much more equipped to be able to say to a partner, no, it's not enough to say, I've referred this to the EAP. What would be the best option here is to do whatever, whatever approach might be recommended in the situation.
And I think actually that has also assisted HR professionals with their own wellbeing, because when we were first called into law firms 8 years ago, we would see the HR people going, I've had to go to a case conference with a psychiatrist and I've come out and I've agreed to all this stuff, is that right? And we'd kind of go, actually you maybe shouldn't have agreed to all those things. But they were struggling with their impact of that and their own wellbeing. So having the framework, I think, has been really great in terms of their own wellbeing too, to say, okay, I've followed the process, I've done everything I could do, and I've referred in appropriately, and now we've got visibility, and we're working, if we are a part of the solution, we're working as a team. We're doing this together. You're not on your own. We are absolutely assisting and supporting you as a team to get this recovery and giving this recovery a go.
And it's okay not to feel 100% confident when you go into these frameworks and situations, because as we know, like you say, conversations can be difficult. You think it might go one way and it's going to go the other, and I think it's important for us all to recognise in this room that some of us aren't experts, but it's about the intention. It's about the attitude and the intention to start with, because we know that once we change attitudes, we can influence intentions that will transfer to behaviour change, which is of course what we are all in this for. In terms of social issues affecting our communities and our workplaces, what do you think, we're talking a lot about mental health now. Is there anything that you think, is going to be the next topic? I think we had a little sneak preview in the video there. What aren't we talking about?
I think there's certainly, I've noticed, even just in the last 12 to 18 months, very much an emerging risk of vicarious trauma. Deb was talking about that in the video. That we are seeing, I think traditionally we've always associated vicarious trauma in roles such as emergency services, hospital, community service workers, teachers, all of those roles that we often traditionally will associate with vicarious trauma. But we've seen much more of an emerging risk in the last 18 months, where people who are in roles have found themselves in positions where they are now exposed to vicarious trauma, and they didn't sign up for trauma as part of their job, but due to change in environmental circumstances or work-related circumstances, have now found themselves in these positions. So some examples of some projects we've been working on in the last 18 months has been working with a large government department with a lot of their people who have been supporting drought-affected landholders. So last year we're on a very big project with them, and they did not sign up for trauma as part of their role. They were signing up to, I'm passionate about animal welfare, we're in fisheries, I'm passionate about looking after the fish and the water supplies and all those things. But because of the drought, have now found themselves responsible for putting down thousands of livestock every month, of having to be involved in fish kills, in having to being abused by members of the general public when they're having dinner because of their roles, and having to talk to really distressed landholders. So that's certainly one where they're exposed to elements of vicarious trauma. Even the project we've been on recently with regional and agribusiness bankers who were signed up to be great at their role because I'm great at finance, and now finding themselves supporting landholders, and now in very risky conversations around suicide, having to support them and hearing very hopeless stories around the landholders' lives, and they didn't sign up for that, as part of their job. So there's lots of pockets now where we're seeing organisations get much more sophisticated and saying, we've actually got some roles here in our organisation that we hadn't recognised before. Our business environment has changed, and now we have roles who are at risk of exposure to vicarious trauma. So that's certainly a huge area where we've been really doing a lot of work in the last little while. And the other area I would say is I still think that there is still some fear and concern, particularly around family and domestic violence as well. So that would be my other area, because the prevalence rates are just as high, 1 in 3 women and 1 in 9 men who will experience that as an issue. And I still do think, particularly in professional services, I still think that there is a stigma around that, because you might have some highly educated people that feel as if I am ashamed or embarrassed or guilty about coming forward because I'm experiencing this issue. So that would be my other kind of area to keep on the radar too.
I think you've taken both of mine. So.
Yes, I was going to say, Justin.
So domestic violence for us is a really major concern. I'm very proud to work for the bank, and that we've actually had a policy of unlimited leave to support people going through domestic violence. I think that's a fantastic, bold step. I think it's the right step, and to remove that concern from people going through that amount of distress is fantastic. Vicarious trauma, absolutely. We have very much the same issues of customers coming in all kinds of personal and financial distress, and branch staff who maybe haven't gone through that before suddenly taking on somebody else's problem, trying to help them out. The bank is very good at assistance programs for them, but we really need to support our people better to go through that.
I'll wholeheartedly agree with both Justin and Rachel, but the other one that I wouldn't mind just adding in, it's possibly just top of mind for me because I went to a seminar on it this morning, but sort of we're in a post-Me Too, well, just post-Me Too, but we've also got the introduction of the whistleblowing legislation in Australia, and so that's going to lead to all of us in the room having whistleblower policies and whistleblower hotlines, and I think we'll find that there'll be a mix between sort of whistleblower complaints that are also sort of workplace personal grievances, and how that plays out and how it changes the culture in organisations about how people choose to bring forward complaints and how they're dealt with. So I think that's just something to keep an eye on.
Yeah. Some food for thought as to where we'll be sitting and what we'll be talking about in the next 20 years when we are all 40, Deb. Yeah. Well, thank you very much. That's. I wondered if anybody from the floor would like to ask any questions to our panel. Any burning thoughts, comments? No? I think there you go. Answered the questions well. So good. Yeah, got off lightly. Well, thank you very much. Thank you. That was both insightful for me too. So thank you very much for your time. Can we give a round of applause? Thank you.